Hi, this is Paul Wise and welcome to the Lawn Vets video series. In this short video I'm going to be sharing some information about diarrhea in your pet. It's important to know that diarrhea symptoms can be quite diverse. Frequency, urgency and loose watery stools are obviously the classic signs that your pet typically will have. But also, so is straining. Many clients bring their pets in for what they think is a problem with constipation. The symptoms they describe involve a bout of explosive watery stool, after which their pet stays hunched over it as though he still needs to go, but can't. What this looks like to some owners is constipation, but it's really just another sign that their cat or dog is having a bout of diarrhea. Diarrhea upsets the normal rhythmic contractions and sensations of the GI tract, causing your pet to feel the constant need to eliminate. Thus, longer episodes of hunching and straining. Other symptoms that can go hand in hand with a case of diarrhea will include fever, lethargy, malaise, loss of appetite, and potentially dehydration. So what causes pet diarrhea? Diarrhea is a very common condition that can range in severity from a mild inconvenience to a serious condition in which the animal can become very sick and dehydrated. The reasons your dog or cat gets diarrhea are numerous and varied. Some of the main ones will include, for example, dietary indiscretion. This is when your pet eats something they shouldn't. Or possibly it might be a sudden change in diet, and this is by far the most common cause of diarrhea. There are of course others, for example, ingestion of foreign bodies, intestinal parasites, bacterial infections, viral infections, dietary intolerance, inflammatory bowel disease or IBD, liver disease, pancreatitis, hormonal problems, poisons, cancers. These are all possible causes. Now, how do you know when it's serious? If you've got a puppy or a kitten, especially if they're unvaccinated, or you have an adult pet but they're small in size, or your pet maybe is older, or perhaps there's vomiting and the diarrhea maybe has some blood in it, if your pet seems lethargic, then if you have any of these signs you should phone a surgery for an appointment, as this might be a more serious problem. If on the other hand your pet is fully vaccinated, is an adult who's in good body condition, is not vomiting and is not lethargic, they've only had a single episode of diarrhea, then it is probably safe to initially monitor and treat your pet at home. However, if you're not sure, or indeed you are in any way uncertain, then please do phone a surgery for advice, at which point my trained staff can ask a few questions to obtain a history, check your pet's notes on our system, and then give appropriate advice, such as recommending an appointment or symptomatic treatment at home as they feel is appropriate. So when appropriate, how might you treat a pet with diarrhea? If your cat or dog is otherwise healthy and her behaviour is normal, first of all starve your pet for 24 hours. Make sure they have plenty of water available during this period, not too cold. Once your pet has been starved for 24 hours, offer them a small bland meal, preferably plainly cooked boiled chicken or roasted chicken and plain boiled white rice. If it is eaten and no more diarrhea is seen after 6 hours, then continue feeding small amounts several times a day for the next 5 days or so. This bland diet will be gentle on their digestive system as your pet recovers. The majority of cases of sudden onset diarrhea will respond to this protocol. How can you prevent diarrhea in your pet? Even perfectly healthy dogs will sometimes get diarrhea. To help keep their digestive system healthy, be sure to keep them parasite free with medications that we can provide and keep them vaccinations up to date. Don't let your dog into the rubbish or let them eat spoiled food. And when walking them, try and prevent them from eating plants or anything they find in the streets, including feces from other animals. You can help your pet avoid diarrhea by not giving them dairy foods. Despite their pleasure in drinking them, some pets are lactose intolerant, and dairy can cause gas and diarrhea. Last but not least, if you plan to change your cat or dog's food, be sure to make the transition slowly. Adding it in gradually to the current food a week or so is a good time period. This makes it easy for the gastrointestinal tract to adjust to the new food. As always, if having watched this video you have any questions or if you encounter any difficulties, then please phone or email the surgery. We're here to personally help give you the very best possible advice and treatment possible for your much loved pet. Thanks for watching. Any feedback regarding this video would be very much appreciated.